If you want to understand why your blood sugar stays stubbornly elevated, even when you're eating less and moving more, don't look at your willpower. Look at the fat you cannot see. The fat wrapped around your liver, your pancreas, and your intestines right now. Here's something that should stop you cold. You can appear to be a perfectly normal weight on the outside and still carry dangerous levels of visceral fat suffocating your internal organs. Researchers now refer to this condition as TOFI, thin outside, fat inside, and it affects an estimated 40% of adults who genuinely believe they are metabolically healthy. But here's what I need you to understand. One specific fruit, one that most people already have access to, has been shown in peer-reviewed clinical trials to directly shrink visceral fat deposits and restore the body's ability to respond to insulin. In the next few minutes, I'm going to show you exactly what it is, why it works at the cellular level, and how to use it correctly so you can begin seeing results within 7 days. Most people believe that insulin resistance is a condition that develops gradually over decades, something that happens to you, not something you can meaningfully reverse through dietary change. But after nearly 15 years practicing emergency medicine and studying metabolic disease, I've witnessed something that completely shifted how I advise my patients. Insulin resistance isn't a one-way door. The metabolic pathways that drive it are remarkably responsive to specific dietary compounds. And one fruit contains a rare combination of those compounds in a form your body can begin utilizing within hours of consuming it. An emergency medicine physician and metabolism researcher. After almost 15 years watching patients arrive in crisis, not just from accidents or trauma, but from entirely preventable metabolic collapse, I became consumed by one question. Why do some people's bodies hold on to visceral fat like a locked vault, while others stay lean without any apparent effort? What I found in the research literature genuinely surprised me. The answer isn't calories. It isn't even exercise frequency. It comes down to a process happening inside your fat cells and your liver called lipid oxidation regulation. And a handful of natural compounds can either switch it on or keep it locked off. Most people are unknowingly keeping it locked off every single day. The fruit I'm about to describe switches it back on. In this video, I'm going to show you why visceral fat is biologically different from subcutaneous fat and why standard dieting almost never removes it. I'm going to show you the specific fruit demonstrated in clinical trials to reduce deep abdominal fat, measured with precision imaging, not just a bathroom scale. I'll walk you through the 3 biological mechanisms this fruit activates to simultaneously burn fat stores and rebuild insulin sensitivity. I'll give you the exact daily amount and preparation method that maximizes the active compounds, because how you eat it matters enormously. I'll share 4 clinical tips I give my own patients to accelerate results in the first week. And I'll tell you about the 4 mistakes that cancel out all the benefits and why most people are making at least 2 of them right now. Quick favor before we dive in. I receive messages every week from people who've been watching my videos for months without realizing they weren't subscribed. Could you check on that right now? It's completely free, takes about 2 seconds, and it genuinely helps this channel reach more people who are searching for real, science-backed health information, rather than the noise that floods the internet. Let me explain what visceral fat actually is, because most people carry a completely inaccurate mental picture of it. When people think of body fat, they imagine the soft layer beneath the skin, the kind you can pinch at the waist. That's subcutaneous fat. And while excess amounts aren't ideal, it's relatively passive. It stores energy. Visceral fat is something else entirely. Think of your abdominal cavity the way you'd think of an industrial warehouse. All your vital machinery is housed inside. Your liver, your pancreas, your kidneys, your intestines. Now imagine someone slowly pumping that warehouse full of expanding foam insulation. At first, the machines still run, but gradually, that foam presses against every surface. It wraps around the ventilation ducts. It infiltrates the electrical wiring. It fundamentally changes the atmosphere inside the entire space. That is visceral fat. It doesn't simply sit there passively. It is a biologically active tissue that continuously secretes pro-inflammatory molecules called adipokines directly into your portal vein, which drains straight into your liver. Your liver is then bombarded with inflammatory signals around the clock, and one of the first things it does in response is begin ignoring insulin's commands. That is where insulin resistance begins in most people. Not in the muscle, not in the pancreas. It starts when the liver becomes overwhelmed by the chemical interference generated by visceral fat. Now here's where the avocado enters the picture. Because despite being dismissed by many physicians as simply a high-fat fruit, the avocado is, in the most precise scientific sense, a pharmacologically complex food that targets exactly this chain of events. Researchers at the University of Illinois discovered something remarkable when they gave adults with excess abdominal fat one avocado daily for 12 weeks. Using DEXA-imaging, dual energy X-ray absorptiometry, the gold standard for body composition measurement, participants who consumed the avocado showed a measurable reduction in visceral adiposity compared to a matched control group. Not subcutaneous fat, visceral fat. The question worth asking is why? What is the avocado doing at the cellular level that produces this specific result? That is where this becomes genuinely fascinating. The first mechanism is oleic acid and the PPAR alpha fat-burning switch. Avocados are approximately 71% monounsaturated fat, with oleic acid as the dominant compound. Oleic acid does something most dietary fats cannot. It binds to a nuclear receptor inside your fat cells and liver cells called PPAR alpha, peroxisome proliferator activated receptor alpha. Think of PPAR alpha as the master ignition switch for fat oxidation. When it's activated, your cells shift their metabolic priority toward burning stored fat as fuel, specifically the triglycerides packed inside visceral fat deposits. Most common dietary fats activate PPAR alpha weakly or not at all. Oleic acid from whole avocado activates it consistently and measurably. The second mechanism is soluble fiber and the gut-liver axis reset. One medium avocado contains approximately 13 to 14 grams of total fiber, with roughly 5 grams of that being soluble fiber, including beta-glucan and pectin. Here's why this matters specifically for insulin resistance. Soluble fiber is fermented by gut bacteria into short-chain fatty acids, particularly butyrate and propionate. These compounds travel to the liver through the same portal vein we discussed earlier, but instead of delivering inflammatory adipokine signals, they deliver anti-inflammatory signals that help resensitize liver cells to insulin. They quiet the metabolic noise so your liver can hear insulin again. The University of Illinois research measured gut microbiome composition alongside their visceral fat data, and the avocado group showed significantly higher populations of Faecalibacterium prausnitzii, one of the most potent butyrate-producing bacteria known to science. The third mechanism is avocatin B and direct insulin sensitization at the mitochondrial level. This is the mechanism that most surprised researchers when it was first characterized. Avocados contain a rare fatty alcohol compound called avocatin B, found in virtually no other commonly consumed food. A research team at McMaster University in Canada discovered that avocatin B inhibits a specific fat metabolism pathway in dysfunctional fat cells, which reduces the production of toxic metabolic byproducts called ceramides and acylcarnitines inside muscle cells. These byproducts directly interfere with insulin receptor signaling at the mitochondrial membrane, essentially jamming the signal that tells cells to absorb glucose. By reducing ceramide and acylcarnitine accumulation, avocatin B clears that interference. In their metabolic studies using human muscle cells, avocatin B-treated cells demonstrated restored glucose uptake by up to 25%, comparable to what certain pharmaceutical interventions produce from a compound found inside a whole fruit. The fourth mechanism is lutein and the inflammatory suppression loop. Avocados are one of the richest lutein sources among all fruits, not among leafy greens, among fruits. And lutein is not simply an eye health compound, despite how it's typically marketed. Lutein is a potent inhibitor of NF-kappa B, the master transcription factor that controls the production of inflammatory cytokines, including TNF-alpha and interleukin-6. Those two molecules are among the primary drivers of insulin resistance in adipose tissue. When lutein suppresses their production, the entire inflammatory cascade that perpetuates visceral fat accumulation begins to slow within 7 days of consistent avocado consumption. Measurable reductions in fasting interleukin-6 have been documented in dietary intervention studies. The evidence on avocado and visceral fat is not anecdotal or theoretical. Let me walk you through the most significant research available. The landmark study I referenced, published in the Journal of Nutrition by researchers at the University of Illinois at Urbana-Champaign, enrolled 105 adults with overweight or obesity in a 12-week randomized trial. One group consumed 1 large avocado daily. The control group maintained an isocaloric diet without avocado. Using DEXA scanning at baseline and at the 12-week mark, women in the avocado group showed a statistically significant reduction in visceral adiposity index, while the control group showed no change. Critically, total calorie intake was matched across both groups, meaning the fat reduction was not explained by eating less. A separate clinical trial published in Nutrients, conducted across multiple research institutions, examined avocado consumption specifically in adults with metabolic syndrome, defined as the combination of elevated fasting blood glucose, excess abdominal circumference, elevated triglycerides, and low HDL cholesterol. After 10 weeks of daily avocado intake, participants showed a 17% reduction in fasting insulin levels and a 19% improvement in HOMA-IR score, the standard clinical index for quantifying insulin resistance. These are changes that clinicians typically see with structured medication protocols in early metabolic disease. The McMaster University team studying avocatin B, led by Dr. Paul Spagnuolo, published findings demonstrating that this compound selectively disrupts incomplete fat oxidation in dysfunctional metabolic cells without affecting normal healthy cells, a specificity that is pharmacologically unusual and clinically significant. Their subsequent metabolic studies using human skeletal muscle cells showed restoration of normal glucose uptake signaling, suggesting avocatin B addresses the mitochondrial dysfunction underlying type 2 diabetes progression directly. Finally, a 2022 investigation from the University of California examining gut microbiome response to daily avocado consumption in 163 adults over 12 weeks found that compared to controls, daily avocado consumers showed significantly increased abundance of Faecalibacterium prausnitzii and Lachnospiraceae, bacterial families associated with improved intestinal barrier integrity, lower systemic inflammation, and better glycemic regulation. The researchers confirmed through mediation analysis that gut microbiome shifts partially explained the metabolic improvements observed, meaning the gut was an active participant in the results, not merely a bystander. Now let's talk about the 7-day starting protocol I recommend to patients beginning this dietary intervention. First, eat 1 whole avocado daily, split across 2 meals, half with your first meal and half with your largest meal. A whole medium avocado weighs approximately 200 grams and delivers around 320 calories. Do not reduce other foods to compensate. The clinical evidence is based on avocado added to the existing diet, not substituted within it. Second, squeeze fresh lime or lemon juice over every serving. Citric acid significantly increases lutein bioavailability from avocado by maintaining the pH environment that prevents lutein oxidation during digestion. 1 full lime squeezed over a half avocado is not too much. Third, drizzle with 1 teaspoon of extra virgin olive oil. Quality extra virgin olive oil contains oleocanthal, a compound that inhibits NF-kappa B through a mechanism complementary to lutein. Pairing olive oil with avocado creates an additive anti-inflammatory effect alongside the shared PPAR-alpha activation pathway. This is not a cosmetic combination, it has documented mechanistic synergy. Fourth, include a fiber companion at the same meal. Eat your avocado alongside at least 1 cup of legumes, cooked leafy greens, or cruciferous vegetables. The gut microbiome shifts that produce butyrate require both a substrate and an existing microbial community to ferment it. Feeding diverse fiber sources alongside the avocado accelerates the colonization of butyrate-producing bacteria. Fifth, know that frozen avocado is fully effective. High-quality frozen avocado retains avocatin B, oleic acid, lutein, and all fiber fractions. Thaw at room temperature for 15 minutes and consume immediately. If cost or availability limits your access to fresh avocado, frozen is not a compromise. It is a legitimate equivalent. Sixth, combine with fat-soluble nutrient sources at the same meal. Lutein is fat-soluble and requires dietary fat for intestinal absorption. The avocado itself serves as the fat vehicle, making this largely self-fulfilling. But you maximize lutein absorption by including additional fat-soluble rich foods at the same meal. A palm-sized portion of cooked salmon, 2 whole eggs, or a small handful of walnuts. Seventh, beginning day 4, consider adding half a grapefruit in the morning. Grapefruit contains naringin, a flavonoid with independent clinical evidence for activating PPAR-alpha and specifically reducing hepatic fat accumulation. If you have no contraindication with any medication you take, adding half a medium grapefruit each morning creates a second PPAR-alpha activation event earlier in the day, compounding the metabolic effect. Always check with your physician if you take any prescription medications, as grapefruit interacts with certain drug-metabolizing enzymes. From 15 years of clinical practice, here are the 4 insights I share with every patient starting this protocol. The first is to time the avocado around your highest carbohydrate meal. The soluble fiber and oleic acid in avocado slow gastric emptying and blunt the post-meal blood sugar spike from carbohydrate-rich foods. If your largest carbohydrate intake is at breakfast, eat your avocado then. If dinner is your highest carbohydrate meal, reserve your second half for the evening. The insulin spike reduction at that specific meal compounds over time into measurable HOMA-IR improvements. The second is to never refrigerate whole, uncut avocados. Cold storage halts the enzymatic ripening processes that convert precursor compounds into their most bioavailable active forms. A ripe avocado is best eaten within 24 hours of peaking. If storing a cut half, press plastic wrap firmly against the exposed flesh surface, not loosely over the top of the container, to minimize the oxidation that degrades lutein. The third is to scrape the dark green flesh directly under the skin. Most people scoop an avocado cleanly from the skin and eat only the pale interior. But the darker green tissue immediately adjacent to the inner skin surface, the thin layer most people leave behind on the rind, has lutein concentrations approximately 3 times higher than the pale inner flesh. Take an extra 10 seconds to scrape that layer with your spoon before discarding the skin. It is nutritionally the most potent part of the fruit. The fourth is to reframe your timeline for success. Gut microbiome composition begins shifting within 72 hours of daily avocado intake. Fasting insulin changes typically become measurable at the 21-day mark. Visceral fat reduction visible on body composition imaging appears in the clinical trials between weeks 6 and 12. Your bathroom scale is not the right measurement tool for this protocol. It measures everything at once, including water, glycogen, and lean tissue, none of which reflect visceral fat specifically. Measure your results by waist circumference, how your clothing fits across the midsection, and how stable your energy is between meals. Those are the early biological readouts that tell you the system is genuinely responding. Here are the 4 mistakes I see repeatedly that erase all of this progress. The first mistake is treating avocado as a condiment rather than a therapeutic dose. Patients add 2 thin slices of avocado to a salad 3 times a week and report no change. The clinical evidence was built on 1 full avocado daily. A smear of guacamole or a few cubes in a bowl is not the same thing. You need the complete dose of avocatin B, the full fiber load, and the full lutein concentration to activate the mechanisms described. Commit to the whole fruit every single day. The second mistake is relying on the scale to measure progress in week 1. Visceral fat reduction does not appear on a standard home scale during the early weeks of this protocol, and this causes people to abandon it prematurely. As hepatic fat begins metabolizing more efficiently, lean tissue hydration increases, and glycogen stores shift. Scale weight can actually rise slightly in the first 10 days, even as visceral fat volume decreases. This is a well-documented phenomenon called lean tissue recomposition. It is a sign of progress disguised as regression. Use a tape measure at the navel level, not a scale, to track your waistline during the first month. The third mistake is pairing avocado with sweetened ingredients. Sweetened smoothies with avocado, avocado toast drizzled with honey, avocado paired with flavored yogurt. Every gram of added sugar in that pairing triggers an insulin spike that partially counteracts the insulin sensitizing mechanisms you're trying to activate. You cannot press the accelerator and the brake simultaneously and expect forward momentum. Keep your avocado preparations savory: lime juice, sea salt, extra virgin olive oil, freshly cracked pepper, and high-fiber companions. The fourth mistake is inconsistency during the establishment window. The gut microbiome shift, the growth of Faecalibacterium prausnitzii populations that produce butyrate and reset the gut-liver signaling axis, requires consistent daily feeding to establish stable colonies. Eating avocado 4 days on and 3 days off in the first 2 weeks produces an intermittent microbial response rather than a structural colonization. Think of the difference between visiting a city 3 times a year versus actually moving there. The first builds familiarity, the second builds infrastructure. The first 14 days are when you are laying biological infrastructure. After that foundation is established, occasional missed days carry far less impact. Accumulating visceral fat and developing insulin resistance is not an unavoidable chapter of growing older. I want you to hear that clearly, because the medical system often communicates the opposite, that these conditions are progressive, inevitable, and manageable only through pharmaceutical intervention. The research does not support that framing. The patients I've watched genuinely reverse their metabolic trajectory. Those who return from pre-diabetic ranges to normal insulin sensitivity, whose follow-up imaging shows visceral fat that was measurably present 6 months ago, now significantly reduced. They are not people with unusual genetics or extraordinary discipline. They are people who consistently made small, specific choices that gave their cells the biological signals needed to begin functioning correctly again. Every mechanism described today, PPAR alpha activation, gut microbiome regeneration, NF-kappa B suppression, avocatin B's restoration of mitochondrial signaling. Every one of these systems is active inside your body at this moment. They are not relics of youth that you've permanently lost. They are pathways waiting for the right inputs. You cannot access them through motivation alone, but you can access them with a fruit available at every grocery store in the world, starting tomorrow morning. If this information was valuable to you, please subscribe and give this video a like. It genuinely helps this channel reach people who are looking for real, evidence-based health information rather than recycled advice that doesn't produce results. And if you know someone who has been told that their blood sugar or their waistline is simply a consequence of their age, please share this video with them. They deserve access to this research. I'll see you in the next one.